Aging comes with its own set of worries. You start questioning your memory, your balance, your energy. And in the hope of staying ahead of illness, many believe the best solution is to get more health checkups, more scans, more tests, more reassurance. But what if that belief is not only misleading, but quietly harmful? Every year, millions of people over 70 walk into clinics hoping to protect their health and unknowingly walk out with prescriptions, procedures, and stress they never needed. It's not fear-mongering, it's backed by data. Recent medical reviews reveal a shocking statistic. 37% of routine tests in seniors lead to overtreatment. Even more disturbing, 99% of older adults don't realize they're being overtested. It's not their fault. The system is designed to act just in case, even if that case never comes. You think you're being proactive, when in reality, some of these checkups might push you toward unnecessary medications, risky surgeries, or even increase your cancer risk. In fact, one of the tests we're about to uncover is responsible for 5% of all new cancer cases in the US each year. That's the same as daily alcohol consumption. And yet, you won't hear that in a clinic brochure. This isn't about blaming doctors. Most mean well. But what we're facing here is a silent problem buried beneath good intentions and outdated habits. Today, we'll explore 5 common health checkups that could be doing more harm than good, especially for people over 70. We won't speak in vague warnings. Everything you'll hear is backed by science, by real case studies and real outcomes. And what's number 2 on the list? You won't believe how many people have done it without question. For most people, the idea of checking bone health sounds reasonable. A quick scan, no needles. Just walk in, get your results, and feel reassured. But for seniors over 70, especially women, bone density scans can trigger more harm than healing. Here's why. As we age, our bones naturally thin, just like our skin wrinkles or our hair grays. But when you get a DEXA scan, that's the fancy name for it, you're likely to be told your bone density is low, even if there's no real danger. That one label, osteopenia, can flip your life upside down. Suddenly, you're prescribed bisphosphonates, medications meant to strengthen bones. But they often come with unseen side effects. Jaw necrosis, yes, the bone in your jaw dying, burning in the esophagus, and brittle bones that fracture in strange ways. Let me tell you about Helen, a 75-year-old grandmother from Michigan who loved gardening and never missed her morning walks. Her doctor ordered a scan during her annual checkup. The results showed mild bone thinning. Nothing urgent, but enough to raise a red flag. She was given medication. Within weeks, she developed acid reflux so severe she had trouble sleeping. By month 2, her jaw started to ache. She stopped gardening. She stopped smiling. When she came to our clinic, we stopped the meds immediately. Instead, we gave her a real plan: resistance band training, vitamin D, leafy greens, and calcium-rich foods like sardines and sesame. A year later, she was back in her garden, stronger, steadier, and pain-free. Science backs this up. A 2022 study in Osteoporosis International found that exercise, nutrition, and vitamin D lowered fracture risk by more than 20%, far more effective than meds for people without severe osteoporosis. And here's the kicker. A 5-year trial of over 1,200 women found that bisphosphonates reduced fracture risk by just 0.3% in seniors over 70. That's not a cure. That's a coin toss. So what's the takeaway? If you haven't had falls, you're active, and your bones haven't been breaking, you don't need fear-based treatment. What you need is a stronger lifestyle. Lift light weights, get sunlight, eat smart, build balance. A number on a scan shouldn't scare you into a life of side effects, especially when that fear does more damage than a missed fracture ever could. But if you thought that was troubling, wait until you hear about the next checkup. It involves your brain, and in some cases, it leads to surgery. You forget where you put your glasses. You walk into a room and can't remember why. You start to wonder, is it just aging or something worse? That fear of memory loss, dementia, Alzheimer's is real. And for many people over 70, it's enough to land them in a neurologist's office with a referral for a brain MRI. But here's the truth no one wants to say out loud. Most brain MRIs in older adults reveal nothing alarming, only normal signs of aging. Slight shrinkage, white spots, minor changes in brain structure that are as natural as wrinkles on your skin. But once those images are printed, the damage begins. A single vague note in a report, White matter changes can spark weeks, even months of anxiety. Suddenly, you're sent for more tests, maybe even a spinal tap. Some are told they need a biopsy. Others spiral into depression, convinced their brain is deteriorating. Take Walter, a 74-year-old retired math teacher from Florida. He came in worried that he was forgetting more names lately. Nothing major, but enough to nag at him. His doctor sent him for an MRI. The scan showed minor age-related changes. That phrase alone shattered him. Walter stopped driving. He avoided social events. He began withdrawing, convinced he was heading toward dementia. But when we ran a standard memory screening, a simple test with paper and pencil, he scored perfectly within range. There was no disease, no decline, just a man who needed better sleep, less stress, and a reminder that aging doesn't mean broken. In fact, a 2021 study in Neurology Today reviewed over 3,000 MRIs in seniors with mild memory concerns. Only 3% showed anything treatable. That means 97% of those patients went through fear, confusion, and unnecessary follow-ups for nothing. So what's the better approach? If you're dealing with occasional forgetfulness, but no seizures, sudden behavior shifts, or rapid decline, start with a cognitive screening. It's quick, low stress, and far more accurate for what matters: attention, memory, problem solving. And the treatment? It starts in your kitchen and your bedroom. Hydration, better sleep, omega-3s, brain games, connection, movement. The small, consistent actions that actually support cognitive function. Don't let a machine tell you who you are, especially when the picture it prints may not show the full story. Up next, a heart test given out far too often, one that may lead you straight to surgery, even when your heart is just fine. You feel a bit tired walking uphill. Maybe your chest feels tight now and then. You're over 70 and someone says, "Better be safe, let's check your heart." So you get scheduled for a cardiac stress test. They strap you to a monitor, put you on a treadmill, or worse, inject medication to mimic exercise. It sounds advanced. It sounds smart. It feels safe. But here's the catch. For many older adults, this test does more harm than good. Why? Because it often leads you down a road paved with false alarms, unnecessary surgeries, and serious complications, all from a test that may not even be needed in the first place. Let's break it down. Studies show that in people over 70, stress tests can have a false positive rate as high as 40%. That means the test says your heart is in danger, even when it isn't. And what happens next? You're sent for more testing. Sometimes an angiogram. Sometimes even a stent or bypass surgery. Not because you have life-threatening symptoms, but because a machine guessed wrong. Take Raymond, a 76-year-old retired postman. He walked daily. No chest pain, just a little fatigue climbing hills. His doctor, just to be cautious, ordered a stress test. The results were unclear, so he was referred for a catheterization. They found a mild blockage, not serious. Still, they placed a stent. That same night, Raymond had a bad reaction to the contrast dye. His kidneys were damaged. He spent 6 days in the hospital. And the worst part? His fatigue didn't improve, because his heart was never the problem. He just needed better hydration, balanced meals, and a bit more rest between activities. In 2017, a major study in JAMA Cardiology found that over half of the stents placed after stress tests offered no real benefit. No improved survival, no better quality of life, just more risk. So what's the smarter move? If you're not experiencing clear cardiac symptoms like sharp chest pain during activity, shortness of breath when climbing stairs, or sudden drops in energy, you may not need a stress test at all. Instead, consider a resting EKG or a coronary calcium scan. They're less invasive, lower risk, and provide clearer answers when truly needed. Your heart deserves care, but it also deserves protection from fear, from unnecessary interventions, and from decisions based on just in case. And next, we're diving into a procedure so common, it feels like a rite of passage after 50. But after 70, it may cause more harm than it prevents. For decades, colonoscopy has been hailed as a life-saving tool. It's become routine, almost automatic. Once you turn 50, the recommendation is clear. Schedule a screening, then again at 60, and maybe again at 70. But here's a question few dare to ask. When does screening stop helping and start hurting? Let me introduce you to Dana, a 73-year-old bakery owner. No family history of colon cancer, no digestive symptoms. She exercised, ate well, and had 2 clean colonoscopies in the past. But her new doctor, fresh out of residency, recommended another just to be safe. During the procedure, a tiny polyp was removed. Harmless, they said. Dana was sent home the same day. That night, she collapsed in her kitchen. Severe abdominal pain, a tear in her colon. She spent 9 days in the hospital recovering from a complication that never should have happened. The truth? After age 70, the risks of colonoscopy increase dramatically, especially for those without symptoms. The PrEP alone, harsh laxatives, can cause dehydration, dizziness, even kidney strain. The sedation, often overlooked, can affect brain function in older adults. And the procedure itself carries risks: bleeding, tears, heart rhythm issues. A 2019 study in JAMA Internal Medicine tracked over 1.3 million seniors. It found that for every 1,000 colonoscopies done in patients over 75, only 2 lives were saved, but more than 20 people experienced serious complications. That's a 10-to-1 harm to benefit ratio. And even when polyps are found, many are slow growing, unlikely to cause harm in someone with limited life expectancy. In fact, removing them may cause more trauma than leaving them alone. So what's the better option? For seniors over 70, especially those in good health with no symptoms, a non-invasive stool test like the FIT, fecal immunochemical test, can be safer and effective. No sedation, no PrEP, done at home, and it still detects the majority of concerning cases. Here's what matters most. Screening should never be automatic. It should be thoughtful. Ask, have I had this test before, and was it normal? Do I have symptoms now? What will I do differently if they find something? Because once you start down the path of repeated colonoscopies, it's hard to step off. You enter a system that assumes more is better, even when your body is saying enough. And speaking of more, there's one test left, more dangerous, more misleading, and more widely promoted than all the others. It's marketed as the ultimate prevention tool. But for seniors, it might just be the biggest health trap of all. At first glance, it sounds like a dream offer, a full-body CT scan. No symptoms required. Just walk into a sleek clinic, pay a fee, and walk out with a detailed map of your entire internal health. It feels proactive. It feels modern. It feels like you're taking control. But what if I told you that same scan could quietly increase your risk of cancer, trigger a chain of unnecessary biopsies, and leave you worse off than before? That's not a warning. That's data. Let me introduce Marcus, 80 years old. A former martial arts instructor, strong, healthy, and proud of his fitness. During a health fair at a luxury clinic, he was offered an elite checkup package, CT scan included. They found a tiny nodule, just 3 millimeters, in his lung. It meant nothing. But once it was spotted, the wheels started turning. First came a PET scan, then a biopsy. The procedure collapsed part of his lung. Marcus was hospitalized for 2 weeks, struggled to breathe for months, and was left wondering why he agreed to the scan in the first place. The result? The nodule was benign, a normal part of aging. But the damage was already done. Here's what most people don't know. A full-body CT scan exposes you to between 10 to 20 millisieverts of ionizing radiation. That's equivalent to 500 chest X-rays in one go. According to a 2023 modeling study in JAMA Internal Medicine, the rising use of CT scans in the US may now account for up to 5% of all new cancers. That puts them in the same danger category as daily alcohol consumption. And it gets worse. These scans often detect harmless findings, calcifications, cysts, scars, which then spark fear and further tests. It's not early detection. It's incidental discovery of things that were never going to harm you in the first place. The result? You're biopsied. You're medicated. You're told to come back in 6 months for another scan. You go from healthy to patient. So who really benefits from these scans? The clinics, the imaging centers, the companies selling peace of mind. But the American College of Radiology is clear. Full-body CT scans for symptom-free adults are not recommended. No proven benefit. High potential for harm. If you're experiencing specific symptoms, unexplained weight loss, coughing blood, visible swelling, then targeted imaging makes sense. But scanning your entire body for no reason? That's like searching for treasure with a landmine detector. You might find something. But the explosion? That's on you. What's smarter? Listen to your body. Stay in touch with a trusted primary doctor. Prioritize tests with a purpose, not out of fear. Because health isn't about catching shadows. It's about clarity, connection, and confidence in your own well-being. Modern medicine is powerful. It's helped us live longer, survive illnesses that once meant certain death, and do things we never imagined after 70. But here's the part we don't talk about enough. Just because we can test for something doesn't mean we should. You've now seen 5 common health checkups that, while well intentioned, can spiral into fear, overdiagnosis, and even harm, especially in older adults who feel well. Each of these tests had the same pattern: a small concern, a routine scan, a vague result. And suddenly, a person who was active, happy, and independent becomes a patient, hooked into a system that often doesn't know how to say, "You're fine, go live." So, what do we do instead? We ask better questions. Before any test, ask, what happens if it finds something? Will this test change my treatment or my life in a meaningful way? Are the risks of knowing greater than the benefit of not worrying? Because real prevention doesn't start with a machine. It starts in your kitchen, on your morning walks, in your sleep habits, your conversations, your joy. It's in the decision to move your body, nourish it, rest it, and protect your peace. It's in the courage to say no when a test is offered just because. We're not saying tests are bad. They save lives when used wisely. But more isn't always better, and fear is not a diagnosis. So if you're over 70 and feeling pressured into a checkup that doesn't feel right, pause. Listen to your body. Ask questions. And remember, your health isn't just in test results. It's in how you live and how confidently you choose what truly matters.